Hi everyone, I'm Dr. Lid of Rehab and Revive Physical Therapy. We have Tim as our wonderful guest. Today we're going to talk about the organs, the viscera, and the way you can plunge it. So this is kind of neat. This is definitely check with your healthcare provider. Make sure this is right for you. This can be a little bit dangerous. It can create a sympathetic response, heart rate, extra sweating, anxiety. That's normal, but the pros to this are really, we can help expand those tubes, our intestines. Those are tubes. Those need to be, have some space. And then, we want to get away from those restrictions that really can clamp it down, cause constipation, cause pain, bloating, and, sometimes indigestion or reflux. So these are common things that happen to the patients here. I generally like to find, we're going to start with our principle. 1, location. 2nd, the angle. And 3rd, the amount of suction. Be very careful here. This is your organ, so be nice, play nice. Right, Tim?
Right.
This is one location. I call it the diamond pattern. So 1 here, I go from here, this is number 1. And then I go to ileocecal valve right here. And then I go to ileosigmoid valve right here. And then the bladder is always a great place to do it. So why don't we start here? This is the pylorus. Let's get right here. Let's find the right angle. Perfect. And then I can plunge them. I don't really like that so much because it really causes some, stirs up. But I think oscillating feels good. Or you can just hold it. Or you can do some active stretching by moving your legs or moving your arms. Really try to get this thing moving. Or moving both. Great. So that's one. I wouldn't spend too long, 30 seconds, 40 seconds at most, decompress those organs. Because what we're really trying to go after is those myofascial restrictions. Right there, right there. So at this area, we try to get away from cupping or anything like that. And I think cupping is a little bit more abusive to these structures. So you want to be kind, rewind. Yep. Good. And so right here, if it's too stuck, that means there's stuff underneath. There's a lot of crud underneath. This, but let's get that here and get that there. So otherwise it will leave a ring of bruising and stuff like that. Then the next spot here. So those of you constipated, having a tough time eliminating, this is great. Find the right angle. Good. Do the same thing. I can oscillate, or you can make some motion. On this side, if it doesn't stick very well, that means you don't really need it. He doesn't really need it. He needs it up here. He has stomach issues. I can tell that, right? Yep, stomach issues. Not so much, these are more gas or constipation issues. So we have some, this one's a little stuck right here. But not bad though. Not bad. Maybe a bladder restriction, you have to go often. That's a thing you want to address, but not bad here either, right? More stomach stuff. Some more indigestion is probably what he has to deal with. Bladder, let's see if he's got some stuff here. And that's okay, he doesn't have to, it's not bad on this stuff. But go ahead and do some motions. This is the worst, huh? Mm-hmm. Would you say?
Yep.
Yeah, so the diamond pattern, that's how I do here at the clinic. Make sure you check with your healthcare provider. Make sure it's the right thing to do. You gotta be very cautious on this one. So this will be a limited release video. Good. So right here, 1, 2, 3, 4. You spend about 30 seconds each. It's a great way to loosen the stuff up. These are the pros, but just notice that there might be some, anxiety or perspiration, and that's a normal sympathetic response. Don't freak out. But like I said, make sure it was prescribed to you and you can do it and you're allowed to do it. So I'd be careful about this one, but very great technique and very, very useful for the chronic pain population here. So I'm Dr. Lin of Rehab and Revive Physical Therapy. This is Tim. Thank you again for being our volunteer. If you like what we're doing, please leave a like, subscribe on that little box, leave a comment, and also if you want to email us in private, rehabandrevivemedia@gmail.com. And remember, we can and we will get better together with a plunger.